Dedicated Family Care having an open house today. We have been in business now just over a year. We've expanded into this new clinic space, which has a lot more room for us to see patients. I've added Ingrid as both a registered nurse and a certified medical interpreter to the practice so that we can further reach out to people. Our clinic is slightly different than most clinics because we are a direct primary care clinic, so you don't actually need insurance to come here. We do have patients that have insurance, but for those people who want to try to have a more accessible relationship with their doctor and their nurse, and actually get a lot more affordable care, they tend to sign up here in our clinic. What we're finding is more and more individuals have higher deductibles that they're paying with their insurance, but you get less and less for that. You have to wait months to see your physician, if you get to see your physician, or you have to see whoever's available. The costs of labs and radiology and meds are skyrocketing, and so you end up paying all of this money but not getting a lot of care. People are actually not getting care because things are so expensive. And here we can tell you for one direct monthly membership fee, all of your visits with us are covered. And this can include huge discounts on labs and medications. So we can tell people right up front, hey, if you need your thyroid lab checked, that's going to be $3.85. And if you need 90 days worth of metformin, a diabetes medication, that's going to be $2.88. So we can help them a lot with some of those things. And so we reach out to individuals, but also small businesses in this current climate with everybody trying to get new employees and stuff. Small businesses a lot of times struggle to be able to provide benefits such as healthcare benefits because of the costs of them. So we're finding small businesses signing up with us because at least they can offer primary care to their employees and thereby recruit and retain employees a little bit better. And then the other communities that we're reaching out to, especially now that I have Ingrid, my Spanish has gotten really bad since I left Colorado. So Ingrid is able to help me also reach out to the Latino community much better.
Nuestra meta es llegar a la comunidad y ofrecer servicios médicos de prevención. Este nuevo modelo de cuidados directo primario, el paciente no tiene que preocuparse por deducibles, pagos extras. Con una membresía mensual es suficiente para ver a la doctora las veces que sean necesarias.
So basically I like to say that I'm womb to tomb family medicine. So I do prenatal care, I've delivered babies, all the way through hospice care and end-of-life care. And so most of my career was actually spent in rural areas where there aren't a lot of specialists and stuff. So I do a lot of procedures, a lot of acute care, chronic care, well child care, well person care, screenings. We take off lesions in clinic, we can do stitches, women's health, contraception, just about, anything that you can think of. And then for anything that's beyond what I'm able to do, we are able to refer people to specialists. I have a virtual group that I work with that can sometimes actually save people a visit to a specialist. But we draw labs here in clinic, we get radiology into the clinic if we need it, we refer people to other places if they need it as well. So we're essentially, a full service family practice clinic.
Patients are surprised by the time they get to spend with a doctor who truly listens. Not only, about the condition or disease that the patient might be experiencing, but also their mental state, their mental health now in this time where, most of us live under so much stress. Dr. Molaska really takes the time to sit with them and to listen and to be an advocate and support the patient as much. So they're very surprised, and it's nice to see that patients are like, what? And this is how much it's going to cost, my labs, my meds. So it feels really good, and to help people reach, their best optimal health.
And I think, that is exactly it too. As a physician in one of the bigger systems, you only get 15 minutes with a patient, and that's not why I went into medicine. I want to be able to get to know my patients over time and spend that time talking with them and exploring all of the things that are impacting their health. And then I'm gonna use your example again just because I love it so much. One of the times when you were first interpreting for me and I told the patient, they needed an antibiotic, and I was like, it's gonna be $1.18. And she was interpreting and she's like, what? And I was like, $1.18. And she goes, what? And so I'm like writing it down on the paper saying $1.18.
My jaw dropped.
So being able to provide that kind of, affordability for patients and stuff too is just really good.
Yeah.
We have a very small waiting area because the way we schedule our patients aren't sitting in a waiting area waiting for hours to see me. And then we have what I call kind of the consult room, because a lot of what we do in medicine, again, is talking about things and working things through. So you don't need to have somebody, sitting here on a table in an exam room. But then we have this I kind of affectionately call our procedure room, because it has all of my cabinets and sinks and supplies so that we can do procedures. I can do exams in here. And then we have a couple more exam rooms that we can kind of expand into. So I think the goal at some point in time is going to be to continue hiring other physicians or whatever and continuing to expand the business and the practice. I think the huge thing, and like Ingrid had said too, is kind of the big things are accessibility and affordability. And the accessibility you can't beat, because essentially we had a patient the other day telling us this, where she would call in, talk to the receptionist, who would then leave a message for the nurse would call her back, and then the nurse would have to talk to the doctor, so then she'd have to wait for another call back, and there was just all of this stuff in between. Here, our patients get our personal cell phones and emails, so when they have a question or a concern, they just call us or text us. And so the other night, a patient, text at about 8 p.m., my kiddo has this going on, and what should I do? And she just felt so great being able to just quickly text her doctor at 8 p.m. rather than worrying all night or going into the urgent care or anything. And part of that is just building up those relationships and stuff with patients again, and being able to outreach to the community. Really enjoy it.
In addition to that, we both went into healthcare because we truly want to help people to live their best life, and unfortunately in this system that's hard to do, and so this new model is allowing us to provide that one-on-one patient care and establish that relationship. That's what is special.
It's really exciting to me to see just how quickly you're growing. It seems like in a couple more years you'll have your own building at this rate. But it's, to me, not only is it great to see that, but it's also great to see how the family is so important in these. And family is your middle name, so it's appropriate. But you see that your kids here, parents, spouses, and it's really, to me, the thing I like to see the most when I'm out here, to see the support of the family, because really without them, these businesses wouldn't be successful. So, congratulations. We're excited to see you expanding already here in Fitchburg. And, congratulations.
Thank you.
Let's say a few words.
Thank you. I'm very excited to be expanding. We're very happy with the care that we've been able to bring to patients in the area. I'm super excited to have Ingrid Ortiz here as my nurse and certified medical interpreter. So we're also able to reach out to the Latino community as well here in Fitchburg. The support of family, friends, others in the community, other businesses, all of the people that I've been networking with have been tremendous over the past year. So really appreciate it. Thanks for all being here.
Could you speak a little bit about your model and how it's a little
Sure.
bit different?
Yeah, so the model is direct primary care, which is very different than how most people are used to using health insurance and the medical system. So instead of needing to have insurance when you come here, you basically pay one set membership fee per month. That covers all of your primary care needs with us. So whether you need to be seen 1 week for an ear infection, the next week for stitches, and the next week for your well care, you don't have any co-pays, deductibles, co-insurance, so it makes it a lot more affordable. We also are able to cut out kind of the middle people in terms of labs, medications, radiology. So we're able to tell you right up front that if you need a thyroid lab test, it's going to be $3.85 through the clinic. So a lot of people really find the accessibility to Ingrid and myself, because as patients here, you get our cell phone numbers and our emails, so you can reach out to us whenever you need to. You get long office visits with us, and then the affordability. It's a very different model that a lot of people seem to really be enjoying. And it feels like we're kind of at that tipping point in medicine right now too, where a lot of people are kind of frustrated with the current systems, the lack of access, and the transparency in pricing. So this is a definitely different opportunity for people.
Closer.